I'm here with Dr. Ulrika Tranaeus, who is a senior lecturer at the Swedish School of Health and Sports Science located in Stockholm, Sweden. She was a longtime physiotherapist from 1985 to 2010, working with many Swedish national team athletes and Olympians in a variety of winter sports, ranging from freestyle skiing, skating, and ice hockey. She defended her PhD in medical science with a focus in sports psychology at the Karolinska Institute, which is also located in Stockholm, where she continues to remain as a researcher in her current work. Thanks for taking the time to speak with me today, Ulrika.
Thank you for inviting me.
It would be great if you can talk more about your background and the work that you did for many years as a physiotherapist with high performance athletes.
Yeah, I started as an athlete with bad knees myself, and that started to build my interest for physiotherapy and helping others. And when I got my education, I got the luck to be introduced to some athletes that I was able to help, and they invited me to camps, and then I was in this circus of the national team and traveling for World Cups and so forth. And after a while, I noticed that, yeah, it's not just the back or knees that aches and hurts. It's also the head and a lot of thoughts and stress and anxiety that bothers top elite athletes. So I started to read books and get some education. But after a while, I wanted a more solid education and started at university to take basic or courses to know and build my understanding of how everything works together, not just a quick fix.
Right.
And standing on a World Cup final or whatever, I think many athletes can look over that it hurts a little bit, but the thoughts and anxiety are more performance blocking or decrease their performance.
Right.
And also when that decrease, the risk for injuries can increase.
Right. So it sounds like a lot of the challenges that they were experiencing weren't just specific to injury, but you mentioned that you noticed their psychology was having an impact on their ability to perform. Is that right?
Yeah. I was lucky to work with one of the coaches who I worked with were really into strength building, and actually none of our mogul skiers had knee problems or tore their ACLs, and I think that was because they were so well prepared for World Cups. So we didn't have many injuries, but of course, I mean, ache and body complaints when you compete every weekend. And that's what we know now can lead to a bigger injury.
Right.
Or a more severe injury.
Right. You mentioned that just a moment ago. Maybe you can talk a little bit more about what it is about stress or anxiety that can actually increase athletes' risk for getting hurt.
Yeah, as far as we know, and from my own experience, I think if you are stressed, you're focusing more on that problem or what stresses you than putting focus on the task that you're actually doing. So standing on the top of a mogul course and thinking of your family at home or your unpaid bills takes focus away from what you actually are doing right here, right now, and how you should do it. And that increases the risk for injuries. But also, if you are stressed and anxiety, things happen with your body. You've got more tense muscles that you don't need for performance and other things in the body. So it's very important to have focus on what you actually are doing and not what if and the last run and other things that pops up in your head.
Right.
And that's a skill, something you have to train to actually be able to focus.
Yeah. So kind of that combination of the distracting thoughts that are more common when the athlete gets stressed, but then also the physical changes that happen when the athlete is stressed, like maybe their muscles get tight or they're more fatigued, or kind of timing, coordination, those sort of physical things that then increase their risk for injury. Is that right?
Yeah, yeah.
And I guess in terms of, strategies, or I know some of the research that you've done has looked at different kind of interventions or ways to maybe curtail or manage that stress response.
Mhm.
What are some things that athletes, I guess, can do to help them be in the present moment, or to avoid some of the distractions that you talk about?
Yeah, nowadays, or since the last years, mindfulness have become very popular. Um, but some years ago, when we talked about stress management and different interventions to help athletes, we talk about goal setting. I think still that's very important to to remember what your goal is. What is it you're supposed to achieve, not as results, but what performance or and process do you need to manage to achieve your goals. But also to imagine that, use imagery to prepare for what you're doing, build up your self-confidence and self-esteem, so you trust in yourself. um, Different relaxation techniques such as breathing to lower your pulse and lower your shoulders if they are too stiff. Um, and also stress management of what bother you and how can you deal with that. Is it something you just have to accept, or is it something you can do anything about, and can you do anything about it right now, or can you leave it for a while you're focusing on this instead and deal with it later on, or ask someone else for help.
Yeah. And in the research or in the analyses that you've done looking at different interventions that you mentioned, what does the research say or show about the value of those strategies in reducing injury risk?
Yeah, the risk factor for the major risk factor for injuries, traumatic injuries like accidents, it is stress. So with that comes stress management, which most often include uh, those interventions that I mentioned, like
Mhm.
how do you manage stress? Yeah, with relaxation and with goal setting and so forth.
Right, right. And so would the evidence show that, or are there studies, I guess, showing that when athletes engage in those practices, that it actually can reduce their risk of injury? Like if I'm a coach and, I'm thinking, oh, well, we're getting hurt a lot, aside from the, prevention strategies that you mentioned, the physical training strategies, is there value for the coach to adopt some of these practices if they want to actually reduce the risk of injury?
Yeah, I would say so. Um, uh, Either learn by themselves for own stress management, but also to learn and educate the athletes, or take one sports psychologist to help, for have someone else um, leading this. But of course, I mean, um, a stressed coach influence the athletes more than he or she believes. So I think if the coach knows how to manage their own stress, it also influences the athletes. Of course, it's a tense moment when it's competition and so, but athletes know their coaches so well, so they know that this is the manner my coach is, but now it's something extra, and why is he or she behaving like this, and something is particular is going on, and that stresses the athletes much more, I think, than the coaches are aware of.
Right. So would you say in your experience, I mean, I'm sure you treated, and it sounds like working as a physiotherapist, traveling the world with national team athletes, you would have observed not only athlete behaviors, but coach behaviors. Would you say there's a tendency for the coaches to get more stressed or anxious at bigger competitions?
Yeah, some. I mean, that's the same experience as the athlete, an experience who have attended the World Championships a couple of times and then the second Olympic Games are more calm than for the first time. And it's the same with the coaches. An unexperienced coach can be so stressed and yeah. So they need as much help as an athlete.
Right. Well, I think that's a great point. Just as you were talking, Ulrika, I was thinking about this video that it's with Bob Bauman, who's Michael Phelps's coach, or was, I guess, and he talks. He's asked, like, what do you tell Michael right before the race? And he's like, I tell him what lane he's in, like nothing really important, or there's no sort of magic words. He's like, all the coaching is done before. And he talks about that exact point that you mentioned, that, early in his career, he would be nervous, and he's like, oh, is he going to break a world record? And he's like, he realized that there's not necessarily a lot of value in him over talking or communicating to the athlete at the competition, that the athletes know what they need to do, that generally if they're happier and relaxed, they tend to perform better. And so I thought it was just interesting because he was very reflective of the point that you're talking about, and just saying, I need to just kind of treat it like a regular meet and think about what my stress levels are, how that might impact the athlete. So yeah, interesting points. I guess in terms of kind of once the athlete does get injured, are there certain challenges either that in your role as a researcher and a lecturer at the university or as a physiotherapist, what are some challenges that the athlete experiences or things they worry about once they do get hurt?
When they do get hurt, I think the challenges they meet is to come over the belief and the self-efficacy to trust that they are able to do a return to sport and a comeback. I mean, at the beginning, many of them think that this can't be possible. It's not possible that this happened to me. Can't be that severe. And others think immediately that this is severe and my career is over. So it's a frustration, it's anger, it's so many emotions and feelings that comes to their mind. And many times also it's easier for them to blame someone else, that the coach pushed me too hard, or someone else did this to me, an opponent in hockey or someone else, and it's their fault, instead of just coming to an acceptance of course, not of course, but this happened, I know it, what should I do, and do the lesson, because they are so eager to come back. So to have them understand that this is when we're talking about severe injuries, that this going to be a time with patient and small steps, but it's so many emotions, both giving up and both anger and frustration in the beginning. So it's more in the beginning, it's more of kind of what's going to happen and calm everything down, I think.
Yeah. So are there things that the athlete can do to help themselves kind of calm down a bit, or like manage all those many thoughts or emotions they experience?
I think in the beginning, the most important thing is that they don't blame someone else, because could be someone else's fault, but it doesn't help to have a blame game going on, and not to deny that it's actually happened. What they can do is to seek help, and from the national team, I mean from the federations, or if it's lower level, some sports therapists or doctors that are involved and know what's can understand what's happening and the athlete's demands, because the treatment is kind of the same if I injure myself nowadays or an athlete, but the surroundings of how we explain and how we talk to an athlete compared to an older person or another person is different. So I think it's important that athletes come to someone to understand their needs and who they are. And just so important is to seek help and start to actually listen to that person, build trust if it's possible, and start to do the rehabilitation as soon as possible. Don't delay it, and don't do too much and don't do too little, but actually start the process of doing because I have seen both categories that are just laying down and don't doing the programs because it's too painful or too boring or so, and also seen the opposite, athletes who think if I do twice as much, I will come back much faster. And that's the opposite, because you overload and you stress the sword muscle or the sword body part.
Right. So is there this idea that, to your point about athletes trying to do too much, like sometimes I wonder if there's this kind of myth that, you know, like if I'm an athlete or a well-trained individual, that somehow I can heal quicker, or that if I, you know, do twice as much as recommended, that'll be twice as good. Are those kind of falsehoods, or like, are there sort of certain, I guess, biological time frames within which people heal? Would that be correct?
That's little out of my competence to answer, but from just experience, I don't think different bodies heal in different ways, but I think that a trained body, they have quicker to adapt to the new training.
Mm-hmm.
An athlete has easier to understand what muscles to use and how to use it. And if you are a professional athlete and with full time, you have so much more time to
Right.
do slow training in the swimming hall, to do water training, and to do the cooling down afterwards. You can spend hours on just rehabilitation. A normal person don't have the time, facilities, and support to do that. So
Right.
that's a difference in fast healing, but I don't think biological that you heal faster because you're well trained.
Right. Okay. But in terms of your point about not doing too much too soon, maybe you can just reiterate or add on to why that's important for the athlete not to do that.
Yeah, because in initial, if we're talking about just a ruptured muscle in the shoulder or an ACL injury, a torn ligament in the knee, I mean, it's swollen. The body has its system to heal, and if you stress that, you continue to be swollen and have this inflammatory process for too long, and it's not the healing process can't start to kind of cool down and heal in a good way. And if you're doing too much, you stress it and stress it. And a swollen joint in knee or shoulder, the tissues don't meet, and it's so much fluid in the joint. So it's it doesn't heal in a proper way,
Yeah.
or it prolong the time. So, and if you do too much too soon, you have this swollen joint for the longer time than necessary.
So it sounds like it's important for the athlete to kind of understand that there's the happy medium where if they just, you know, lay down, as you say, and kind of don't do anything or resign themselves to the fact that they're never going to get better, then obviously that's not so helpful. But the
Mhm.
mindset of pushing and doing more, and that can be quite counterproductive as well, it sounds like.
Yeah.
And so in terms of your work with athletes, or even just thinking about the research, you mentioned seeking out and finding supporters or providers who can support the athlete in their recovery. From the athlete standpoint, are there things that help with their communication when they're interacting with physiotherapists, or are there things that the athlete can or should do that help them communicate effectively with treatment providers?
Yeah, to be honest, in their communication, don't try to please the provider too much and say, that's okay, it's okay, it's okay. Instead of, yeah, I feel better. This doesn't work for me. I don't understand how to do this, and gives me too much ache afterwards, and so. But I think if I can turn the question, I think it's more important for the supporter to use a good language and explain and educate the athlete, because sometimes care providers forget that this is the first time maybe this athlete is injured, but for the care provider, the physiotherapist, have seen this hundreds of times. Mm-hmm. So for them it's a normal day at work, but it's a big thing for this athlete, and they must explain and communicate in a good way and educate the athlete. So I think that the opposite way is more important than how the athlete should communicate, more than right. Being honest what she or he feels about the situation, and also if it's not just the body, the ache and pain and the swollenness and so, but also any doubts and mental doubts about recovery. Right. Because many times a physiotherapist have heard this before and can help support, and in other cases then they can recommend someone else to talk to before mm-hmm. it comes to a depression, because one of the common reasons for depression in athletes or mental illness is due to injury. Mm-hmm. So severe injury for an athlete is a risky moment for mental illness.
Right. So, and I think it's important that you kind of mention that, point about how the practitioner is communicating with the athlete, and, even though they've probably seen hundreds or maybe even thousands of injured athletes, to remember that, maybe for the inexperienced athlete, this is all new for them, and that communication and education and information is really important for the providers to help alleviate some of the athlete uncertainties or concerns. But I also like how you mentioned from the athlete standpoint that it is important for the athlete to be honest or to communicate about what they're feeling and experiencing. And I guess part of why I asked the question from the athlete perspective is, I know for a lot of athletes, maybe there's this sense that I need to be tough. I shouldn't disclose pain, or, I better just kind of work through this without trying to over disclose information about how I'm feeling, or that's not, I don't want to be a burden, or that kind of thing.
Yeah.
So yeah, I appreciate your point that there's value for the athlete to be open and honest about how they're feeling.
Yeah. And it's also, when it comes to coming closer to return to sport, it's important to involve the athletes in the club or team or so forth. But I have experienced both ways, that the athletes really want to be close to the team, do the rehab practices close to the team, and have the chat in the locker room and be part of everything. But also the ones that said, no, it's too tough, I can't be there. I prefer to be by myself and with other friends or with a family during this time. And it's too painful to see how they come forward in their progression and performance. And I'm sitting here on my bike and with my rubber band or something. And right. I think when it comes closer to return to sport, I think it's important to push them a little bit maybe, or challenge them. But during the rehab, it's more important to listen to the athlete and what their needs during that time, instead of pushing too hard.
Right. So on that note, you mentioned listening as a form of support. Are there specific kinds of support, I guess, maybe in the initial phases or during the rehab? Are there different kinds of support that athletes need, and do those support types change over the course of their recovery?
Yeah, I would say that in the beginning, I would say it's very important with the information and education, and that needs to be repeated, because what you hear the first times with the doctor after an X-ray with a physiotherapist, that will be forgotten after a while because it's too much information. But down the road, you meet over and over again, and then it's good to repeat those things. What structure damage? How long does it take for a muscle to heal? How long time does it take for a ligament to heal? And those things. And also have those small goals. Now we're doing this boring exercises for taking your swollen knee, or have your knee to be less swollen, and have this. Now we are starting to put a little load on your joint, so you can start to load more and more. And because it's so on the fourth month, you think you have done it so long and it's so boring and you don't see any progressions. But if you can see that, okay, for 3 months I couldn't go without crutches, I couldn't put load on this joint, I couldn't do this, and now I can lift, and I can have this range of motion, and I can do this. It's so easy to forget how you started. So have those small steps and maybe write them down, or yeah, so you actually can evaluate to see, yeah, this is boring, but I do see some progression anyway.
Yeah.
So have this small goal setting, and also that the physiotherapists are talking, not just, and now we are doing those, we have a session with this today, and now we're doing this, but why are we doing this? So they understand that this is for increasing range of motion, or this is for building strength, or this is for endurance, or whatever it is. So the athlete or the patient understands why I'm doing this, not as, okay, I have to do it, but it doesn't make sense to me. But if they understand why it's important, it's more meaningful, and it
Yeah.
also builds their competence of how to take care of themselves.
Right. So giving them some reasoning and rationale, so they're
Yeah.
clear on why they're doing and what the
Mm,
benefit may be of
mm.
doing that exercise, or how it helps them maybe eventually perform sport specific skills is valuable. And in terms of, I guess, the path or the trajectory that some athletes take, like you've alluded to this idea that, like some athletes maybe struggle initially to accept their injury, whereas others maybe more quickly go about the business of recovery and getting involved in their rehabilitation, or that some athletes like to be involved in the team and others withdraw themselves. Do you see differences in athletes' ability to make an effective recovery? Are some just better recovers? Do some kind of get back to sport at a, you know, at a effective level, whereas others less so? And if you see those differences, what would you attribute them to?
I have seen the differences. I have noticed that some come back and some don't, and in expected time, if you can expect a time frame. But I haven't seen any actual pattern that you can say that this is the clue and this is the key for a successful return to sport. I, I know that your research has shown and provided answers to that, so but I haven't seen it myself. But one lessons I learned, that is when I'm working with athletes, especially young athletes, or any athlete, that sometimes I take for granted that their wish is to return to sport. and that's what we are striving for. And when I start to talk about it, what would you do when you come and return to sport, and so, but then one girl said, well, I'm not sure that I want to return to sport. I think I just want to be a healthy girl, and then I want to study at university. And like, yeah, that's a good point too.
Yeah.
Everyone doesn't want to return to sport. They want to get healthy, even if she was a really on her way talented handball player, and could have a successful career. Her goal wasn't to make it to the national team. She just wanted to be free from her pain and injury. So that's important to remember too. But I can't really answer your question.
Yeah. Well, on that note, I guess, would you say it's important to understand what athletes' drivers or motivations are? Like, to not just assume that everyone wants to get back and compete at the same or a higher level than they did before their injury, but to really sort of understand their motivations for coming back and recovering. Is that important to work with the athlete?
Yeah, of course. I mean, I do work with some young athletes as well, and understanding if it's internal or external motivation that drives them. If it's the parents, or if it's the coaches, or if it's just that they have their friends in the teams, or if they really love the sports and want to come back due to the love to the sport, and not just the athletic identity that I am an athlete, what should I do without my sport, but having this inner motivation that I really like to do this, I want to continue with it. So that's something we discuss as well, and I think that's have a meaningful return to sport. You can't do that without having the internal motivation, I think.
So,
and that's something that the care providers can help them with the education, so they have the competence and they are involved, so they can self-determine, or I mean they are involved in the process and progression, not the progression, but the process of healing and what they are doing, the rehabilitation, and also some kind of belonging to a group, either in the team or in the rehab facilities. Many bigger clinics that are specialists on for instance ACL injuries, they have groups that train together, so they can be role models for each others and stimulate and so forth. So they kind of have their training motivations in the rehabilitation clinic if they miss it on the pitch or in the locker room.
So I just want to touch on that point you made, Ulrika, about the internal motivation being needed for recovery. Would you say that if an athlete is kind of really driven by more external factors, like maybe they feel like they have to return because they're an athlete and that's how they see themselves, or maybe there's expectations from other people, or maybe they're earning some kind of income and they need that money to sustain themselves, like, are those less effective motivations? Or, like, I guess I just want to kind of clarify that point, that they do they have to have the internal or the intrinsic motivation? Is their rehab somehow less effective if it's driven just by those external factors? Or maybe you can elaborate on your thoughts on that.
No, I think the outcome of the rehabilitation can be as good as any if you have the internal or external, but the sustainable sports life is not as good if you're driven by the external carrots and the exposure you get or pressure from others to succeed or come back or whatever. If you don't have the inner motivation and think it's fun any longer, I think you don't have the sustainability to continue. And the most risk factor, the biggest risk factor for an injury is a previous injury. And if you have had your injury, you're in great risk of getting a new one. And then you know that you have maybe a 6 or 9 month rehabilitation in front of you after a year after the first one, for instance. And I mean, you should be driven by quite a bit of internal motivation for doing the second part with quality. I mean, anyone can do it if it's your work, but I think that's what we see when patients or athletes think it's really boring with this rubber band training. If you do it for the second time in 3 years maybe, and just doing it because you get a reward afterwards. So I think the outcome for the first injury can be as good if you have internal or external, but for doing a repeated time, you must think it's some value for you in it.
Yeah, well, and as you say, I guess particularly if it's a long-term recovery and the exercises are really kind of tedious or boring, or just to be able to sustain that interest and that focus over a long period of time, certainly the intrinsic motivation seems important, and that's consistent with a couple of studies that I had been involved with or did with my former supervisor, Bob Eklund, and we found exactly what you're talking about, where even for high performance athletes, that intrinsic motivation seemed to be high when they reported why they were coming back. And then it also seemed to be associated with slightly more positive, I guess, performances or perceptions of their performance once they actually came back and competed. Some interesting points, I guess, in terms of the role of motivation there. I guess maybe this is hard to answer, but how much would you say of recovery has to do, or effective recovery, if we'll call it that, has to do with the athlete, and how much of it is a function of the support or the environment around them?
Well, that was a good question. Of course, it's the athlete who's doing the work. I mean, it's not my talk who heals the competitor or the athlete, but I think what the care provider, the therapist, and the support around an athlete says, and how much confidence we built and information and so I mean, I think that's quite important as well. So I think it's kind of goes together. We can't help people that aren't injured, and injured people I mean, of course they can heal, but it might be with better coping strategies and also lessons learned from the injured parts that they can use in the daily life afterwards. So I think it's needed.
Right. So on that note, what are, I guess, some lessons or things that the athlete might be able to take from their injury experience that they can apply to their sport or maybe just to life in general?
Little of the recovery part, that they haven't trained as much as they during a 6 month period time, as if they would be in ordinary training, but nevertheless they can be pretty fit and good when they come back. So maybe challenge how much you train and how much you use recovery, because you use a lot of recover during the healing phase, and maybe you should use that more often during the training as well.
Right.
And also that all the small goals make a big picture at the end, when you understand more and you can actually set goals for a work day or for new competitions or whatever. And that's what I see that many people don't have. For me, it's like a physiotherapist. You have seen plenty of injured people, and for me in sports psych, I know that goal setting is the main concept, but many athletes don't know about it.
Yeah.
I just train and see how good I can be, but how do you evaluate that? I don't know.
Right. So trying to be intentional or specific about, what maybe processes one wants to focus in on with maybe their rehab exercises, but then
Mm,
also taking that and applying it to their training so that they're not just sort of going into practice and saying, hey, I want to get better or I want to
mm,
achieve this, but
mm,
being more intentional and specific about how they're going to do that.
yeah.
Or, you mentioned, I guess, kind of alluded to that idea of injury prevention almost, where they're taking some of the skills from what they're doing in rehab when they're healthy to make sure they don't get injured.
Mm, mm.
So it sounds like, would you say then that there can be some value, I guess, in the injury experience for the athlete?
No one would admit that during the rehab phase that this was something good, but I heard it many times after, that they are, when they actually came back, they were more well trained, because they were capable of, or got the time to train the whole body, not just the knee or the technique they use, the need for the performance. They were able to do swim training and do a lot of exercise, Swiss ball, and a lot of things that built them up, so they were stronger, overall stronger when they
Right,
came back. And also that their well-being was good, because they got the time to spend more time with family or school friends or others, and took the opportunity to do that while they weren't traveling that much or had just the sport in focus.
yeah,
So after a while, well, it was a really boring time and it was so tough, but afterwards I actually felt pretty good and I was strong when I came back, and I had a good season afterwards. So
yeah.
many can say that looking backwards, but they don't see it when they are in the bubble.
Right, right. So if there are sort of valuable elements of an injury or this idea, we talked about before we started recording our discussion about this idea of growth or,
Mm,
remarkable recovery, that the athlete develops in some way, that they're stronger or better as an athlete or performer. If those elements are to exist, it's unlikely the athlete may see it at the time. It's more
mm,
likely that it's with the benefit of, hindsight or experience or kind of looking back, that they can
mm.
see that maybe there's some things. Um, Maybe you can touch on your thoughts about this idea of kind of growth. And again, we were having that discussion earlier, but um, do you, I guess, what are your thoughts on this idea that, athletes grow or emerge stronger in some way? That term resilience is often thrown out. Do you have a perspective on whether, athletes are stronger potentially after the injury, or they perform better, or is that not necessarily the case? Does it depend on the individual?
I think it depends on the individual, but when I ask them, many reflects and think, yeah, actually, I felt pretty good. But it also compared to how were they before they were injured. Uh, if they have, if I got the opportunity to talk to them, they might have got some education about coping strategies, stress management, pain management, goal setting during rehab. And if that's kind of have worked out well, they could feel, yeah, it wasn't too bad at all. It was painful, it was tough, but yeah, I survived and I came back. But I doubt that you get reflect on that and have the coping strategies and feel the growth if you aren't, um, someone have talked about it to you, who with
Yeah.
you, or so I don't think you necessarily get stronger after a rehabilitation time, but if you have used the time well, you got the opportunity to train a little more all around, and got to widen your bubble and come out of your sports comfort zone and do something else. I mean, how many athletes go to see a movie or Friday night, but now you might have the opportunity to do that.
Yeah. So I think that's such a great point about how you use the time really is important to think about and consider. And, as you say, maybe it's a chance to connect with friends that you haven't seen or sort of non-sport people, or, to reflect on different elements of your sport, or maybe to gain strength in, areas of the body that were weak, or, I really like your point about sort of how you use the time, and also maybe that point that, if you're likely to realize some benefit, that maybe some of it is about having conversations with people that help you open your eyes to the fact that maybe there are some opportunities, I guess, to experience growth personally or in terms of your performance, but that doesn't necessarily happen automatically.
No. And one thing that's important also that many, both therapists, but also athletes forget, if you have an injured shoulder, this rubber band training is really boring, but nothing hinders you to do bench training or step training with your legs or other things, or is it your knee that's injured? You can do a lot of things with your arms and back and stomach. So that's what I mean. You can use the opportunity to train. If you think that rehab is so boring, you can use the rest of the part in ordinary training, and that was many people forget, that you can do that in the meantime as well.
Yeah. Well, and that comment is certainly consistent, Ulrika, with a number of other, sport medicine providers and sports psychology people that I've been speaking with, where they say, they're always, or coaches as well, where they say they're always trying to gear the athletes' focus to things they can be doing. And usually one isn't completely physically incapacitated, but if they have a knee injury, they can work on, maybe their upper body strength or other aspects of their body that may be helpful, or, tactical areas of their performance, or analyzing strategy, different facets to their performance that may help them come back. And, also, I think kind of earlier we discussed this point about, whether the athlete emerges objectively stronger in some way, shape, or form may not be that important. That one colleague that I spoke with, Dr. Christian Zepp, he's at the German Sport University. And, I like how he sort of phrased it, that athletes are going to be different after the experience. That it's not just necessarily they're going to, he said that hashtag come back stronger sort of frustrates him, because it's just like, what does that mean? It's kind of a cliche, and sort of the idea that you won't be the same because you've had an experience that changes you in some way and makes you different. But I like kind of what you're alluding to, that, athletes maybe through this experience are developing skills, coping skills that help them with other athletic challenges that they face, injury, of course, being a significant one.
But we shouldn't forget those who are still afraid. I mean, when we talk, it looks like, or it seems like everyone comes back stronger, and do they come back stronger or not? But it's quite some who are afraid of getting a new injury, are afraid to be on the pitch and be pushed and perform the sport again, because could it happen? Am I really sure that my knee or shoulder are prepared for this load and so forth? So that's also part that many are afraid, and they are strong, but it's still a mental part that hinder them from doing the comeback.
Yeah, well, on that note, I know there are a number of studies. Claire Ardern, who I know has done a number of reviews where she found that after ACL injuries, that up to 2/3 of athletes, and I think the one study had about 150 athletes. In another review, they had a bigger sample, and significant portions of athletes who were medically cleared to return did not. and they cited things like fear of re-injury or a lack of trust in their injured knee, as important reasons why they didn't return. So I think that's a great point. Like, it's great to hear those success stories about the athletes who come back stronger, but then of course we don't always hear about the athletes who don't come back or who are physically capable, but just, they are worried or apprehensive, and those concerns, maybe preclude them from doing so. And so I think that's a great point. I mean, on that note, again, coming back to the strategies, are there particular ways, is it things like imagery, discussion? What are some things that in your experience or based on research and teaching are valuable for the athlete who's returning but has those worries or concerns? How do you help those athletes?
I think imagery is really good to see yourself doing this and how you do it and with all those, how it worked out to be on the pitch or slope or whatever again. But also to take the small steps. I mean, if you come from the rehab room out on the field and are supposed to slowly come back, I should also be a little afraid. But if you take the small steps and start to ski again or to play football and increase it slowly, I think that the fear goes away more and more the closer you come. But so it's still the small steps towards the goals you want to achieve.
Right.
And that also builds the self-confidence. If you see, okay, it wasn't a long time ago since you didn't even touch a ball or were on skis, and now you're doing this and this and this, and it's going better and better.
Right.
So building the trust and self-confidence in small steps.
Right. So would you say then that a lot of the psychological readiness then comes simply from the physical ability to perform skills or maybe to meet certain functional criteria?
I think much comes from the physical ability, and then we have some that I don't want to show myself because I'm not that well trained, and my self perception doesn't meet what I was before, and maybe they think I lost muscles, and so I mean it's a lot of emotions and thoughts as well. But I think if you have built up your muscles, you're able to jump and land and do your sport. I think that doubt will decrease.
Yeah. So again, like for the athlete, I guess sort of often being able to do certain things, that I guess when they're not injured, often confidence comes from physical training and preparation, and I guess the same could be said for the injury period. So when they gradually see, and as you mentioned, they're doing certain things, but then they also can have it fed back to them that, okay, well, before I couldn't do this, but now I'm doing these things. But that goes a long way to building the readiness to perceived readiness to return.
Yeah.
So I guess just one final question, Ulrika. If you could share advice to the injured athlete, one piece of advice, or it doesn't have to just be one, but if you could share advice to the injured athlete, what would it be? What helps them, I guess, in their recovery?
To seek support. Don't be shy or think you're the only one with these feeling thoughts and setbacks. Be open, seek support, and communicate to family, friends, teammates, coach, others, what you need, expect, and how from them, and what you need. Don't be tough. I would also recommend to have a form of training diary, but rehabilitation diary, to see what was I able to do week 1, week 2, and then week 30 or something to see the progression, and also have it as a working tool and evaluate. Did I reach? Could I jump on one leg now? No, and I have to train more on this. And now, yeah, I can actually jump on one leg and evaluate and kind of celebrate and do some, yes, I did it.
Yeah.
So celebrate and have those small goals that are so useful in the long term. So seek support, communication, and set your small goals to and don't just write them down, evaluate them. That's the most important part, to actually have this as a working tool and evaluate and have a little celebration for like a goal gesture for every goal you reach, and celebrate.
Yeah, those are great pieces of advice and suggestions, Ulrika. And yeah, I always enjoy our conversations, and it's great to be able to catch up with you. And thanks so much for sharing all of your experience and insight, both from a research and practical perspective. Great to speak with you.
Yeah, likewise. Thanks a lot for inviting me. Like to chat with you too. Looking forward to see you soon.
Definitely.